Muriel, Ruby, let's go. Let's go.
Come on, let's have a candid conversation. Let's talk about it. Just bring it up, we got hope and love.
Yeah.
It's all about you and your well-being. The candid conversation show. Let's go, let's talk about it.
Hey, let's talk. Let's talk. Let's talk. Let's walk it out. Let's talk. Let's talk. Let's talk. Let's walk it out.
It's all about you.
Let's talk. Let's talk. Let's walk it out. Let's talk. Let's talk.
Thank you for joining us for another Candid Conversation. My name is Muriel, and my sister Ruby is not with us today as she was in close contact with someone that was positive for COVID. She is quarantining for safety measures. I'm going to do my best today in her absence. Let's see how I do. Let's get this started. Just because you see a smile does not mean everything is perfect. We all have a story. On the show, we discuss topics that are unspoken and taboo in our community. We are so excited to have a conversation with my Haitian sister Marteng Louis Charles Adolphe. We will be discussing her reign as Miss Haiti International 2021, her entrepreneurship, and HIV. Welcome.
Welcome. Thank you. I know the last time I was here as Mrs. Port-au-Prince, as a contestant for Mrs. Haiti, and this time
Now look
I'm
at
actually
you.
coming flesh
That's
as
right.
Mrs. Haiti.
That's right.
Thank you for having me.
Welcome. We believe our childhood shapes who we become as adults. Can you tell us a little bit about your story growing up?
Well, I was born and raised in Haiti.
Okay.
As you can hear the thick accent.
That's okay.
I was born and raised in Haiti, and my mom. I was not raised with my mom and dad.
Okay.
My mom come to the U.S. for a better life. You know, as our
Right.
parents always come to the U.S. for a better life. I was 8 when she left. So
Okay.
most of my teenagers years, I was raised with uncles and aunties. And I came here in the U.S. when I was 17 years old.
Really? So your parents came here when you were 11?
I was 8.
You were
when my
8?
mom came here.
And then by the
And
time...
my mom and dad, they had split. So my
Okay.
mom came at 8 when I was 8 for a
Okay.
better life, and I actually joined her when I was 17.
17 years old?
17
so
years
tell me
old.
about your life with aunties and uncles.
Life with aunties and uncles, back home, it's one day good, one day not good. But overall, I can say it was a good experience because for what I was grow up with back in the day, that's what shaped me to be the better person that I am
That you
today.
are today. Okay. How was your mom? How was that feeling with not having your mom with you?
Well, she comes when
To
she has a
visit?
chance. She comes to visit.
Okay.
She comes to visit, and we talk on the phone. So it was not as hard as it's supposed to be. So
Okay.
she
Well,
comes.
that's good because I know
Yes.
mommies.
I know.
You know? You know how mommies are.
Yes. We gotta love our mamas.
Oh, yeah.
She's still supporting me still now.
She's here. She lives
She
still
lives here. She
lives
lives
here.
in Miami. I come here when I was
okay.
17. I came to be with her. So she's in Miami now. But let me tell you, beside my husband, my mom is my husband is my right hand side. My mom is my left hand side.
That's right.
Literally.
You got two best friends.
Yes.
That's
She
beautiful.
supports me in everything,
And
that I
everything.
do.
But you need that. We need that. Without support, I mean, we can make it, but with the support,
Support,
you can go
yes.
so far.
Yes,
You
we
can go
can
further.
indeed. Yes, indeed.
Yeah. So, Miss Haiti International,
Yes.
your reign is almost over.
Yes.
Right?
Unfortunately, yes.
So tell me, how was it? How was the year?
It was a good year. It was a good and busy year.
Yeah.
Because I did a lot, but that was the whole purpose
Right.
of being a contestant on Mrs. Haiti. That was the whole purpose of joining the pageant, is to go out, talk about my platform and do the work within the community. And I don't regret anything. I'll do it all over again if I have to.
So what got you started with this?
That's a very
pageant.
good question.
Yeah, what got you started?
What got me started in pageant? And I actually just did a article before, not too long ago, and that was one of the things that, because they told me to talk about anything that I want to talk about. So that was one of the things that I discussed.
Okay.
I love to dress up.
Yes.
I love to take pictures, as you know me
Right.
on social media. But I was never seen me as a pageant queen, because all my life being here in the U.S. is all about medical. She's always scrubs, my hair in a ponytail, tennis shoes.
That's it.
The only thing you see me dressed up is when I go to church. After the rest of the week,
It's scrubs.
it's scrubs. So what getting me into pageant, the whole pageantry, is my last semester in grad school. I was one of the 6 students that was selected for a program, and out of the 6 of us, I was the only one that was chose to work with HIV/AIDS patients.
Really? But that's what you wanted, or they just selected you to work
I
for?
guess it was God. When I went to the interview, 12 of us interviewed for the position. They only chose 6. Out of the 6 of us they chose, I was the only one that was chose to work
For
with
HIV.
HIV/AIDS patients.
Okay.
And I was the only, and I guess it was God, because they asked me in an interview how comfortable, again, that's why my platform, ending the stigma of HIV. That was one of the questions I was asked, how comfortable I am to work with HIV patients. I am comfortable. I've been in the healthcare field for almost 21 years.
You know how to protect yourself. They're people.
Again, it's the stigma. And I'm comfortable working with everybody. And I guess that was the reason that I got the position. But God, with that's what led me to pageantry, because once I was the only one that was chosen as I was working with HIV/AIDS patient, and I was fascinated and in other words amazed, because some of them will not come in to get the treatments.
They were scared
because of the stigma, and especially. And the good thing is I was with underserved community, so it was mostly African American. And immigrants. So some of the immigrants was even Haitians. They were, especially the Haitians, they were not coming in for the treatments.
Because they were scared.
They were scared of the stigma. They were not coming in. So I grabbed that opportunity for me to educate them. And by the end of my intern rotation, they were coming in.
Good.
So I was like, okay, so I guess that's my calling, because I go to conferences, I do have care summits, so I know what it is. HIV is just like we have diabetes. It's like a chronic disease. You just have to take care of yourself. It's not the end of the day.
Right.
It's not the end of the time for you. So that's why I took that opportunity. So, and then I was like, okay, what one thing I can do that can give me a bigger platform for me to educate about HIV/AIDS? I'm like, okay, I reached out to one of my sisters, because I see everything that she was doing. So I reached out to her, and that's how this whole Mrs. Haiti
came about.
Yeah.
Let's go back a little bit. What is HIV?
That's a very good question.
What is HIV?
Because a lot of people don't know.
No.
HIV is a virus. It's attack. The main purpose of this is attacking your immune system.
Okay.
So once it's attacking your immune system gets so weak, then you develop AIDS. So the AIDS, that's why a lot of people can die from, you don't die from AIDS.
HIV. Oh,
you don't die
AIDS.
from HIV. You don't die from AIDS neither. It's the complication of it. The pneumonia or infection. So basically in general, HIV is a virus that attacks you. The main purpose is attacking your immune system. So it decreases the CD4, your CD4, which is your immune system that fighting, basically like that's your soldier. So if your immune will be attacked, so they will protect you. So it's once your soldiers down, so
that's it. They move in.
They move in. There you go.
So why though? I mean, I know you say the stigma, but let's break it down. Because they're embarrassed. They have a thing called pride. They don't want anyone to know that they have this thing, because so many people speak negatively on it.
Oh, okay. So, because I thought you were going to go towards the good part of it. I'm like,
No.
actually, it's the opposite. Because if you remember, in the 80s, the myth, we were the one that bring HIV.
That's what they said.
Especially, and that's the problem now, because statistically, 65% of among people that have HIV are African American.
Okay, 65%.
65%. And currently now, in America, only 1 out of 7 people living in America right now. Only America statistic, 1 out of 7 currently living with HIV, they don't even know. There's 1.2 million Americans right now living with HIV.
So, question for you, as you say that, is it because they're not getting tested, or is it because the lab work is not showing? Because the lab work will show some type of...
The lab work will show, but again, you know you can live with HIV, literally live with HIV for 10 years.
And nobody would
and
know.
not knowing, because you will have no symptoms. It's asymptomatic, which is you have nothing. The only little thing you can have is a flu-like symptom. Imagine if you're in the flu season. You're going to think like you have a flu.
I have a flu, and that's it.
Exactly. So you can live, this virus can literally live inside you for 10 years where you have no symptoms. And during that 10 years, actually doing damages to your immune system.
So how would you find out?
That's why I always said during my whole time I was saying, knowing is power.
Mm-hmm.
That was my whole thing when I was running for Mrs. 18, and that's always my whole thing up front. Get control of your health. Know your status.
Okay.
Go to your healthcare providers. If you have a doctor, go to your doctor. Just ask them. If you don't ask, they're not going to do it.
Right.
Honestly, they're not going to do it.
You have to say something.
You have to ask. And if you don't have a doctor, I promise you, you walk into a health department right now, they'll do it for free.
Okay.
If you don't have insurance, there's program out there that they can actually get you on the right track to get the medication. There is so many ways around.
Okay.
So now,
no excuse.
But again, because of the stigma, you have family. I have patient that tells you they don't want to go to the doctor because they have that nosy family member. Why you always go to the doctor? What's going on with you? They're scared. They don't want to go.
They don't want to tell them.
And then if they go, they don't have the resources to know it's okay to be HIV/AIDS positive. It's not the end of the road for you. It's not. You're not gonna die from it. They don't have the education, and that was the reason that I took the leap of faith for me to educate people about HIV, because it's literally like it's like a chronic, just like other chronic diseases.
Right.
You don't die from it.
You just need to
if
know
you
the
take care of
knowledge.
yourself. Let me correct that. You don't die from it. You can live a long, healthy life if you're taking care of yourself. If you're HIV/AIDS positive,
Go get tested.
you get
Go
tested.
get tested.
That's
Go
the
get
number one
tested.
thing. Know your status. Take control of your health, and that's why I always every time I post, I always said, know your status. Take control of your health. If you don't have a healthcare provider, you can literally walk to the health department
And get it done.
It's not even the health department now. There's so many people with so many organizations within our community here. They can actually send us a test at home for free.
Google it.
Yes, there's a lot of them. So I don't know if I'm allowed to name them.
You can.
Yes, there's Hope and Help.
Okay.
Let's Behave with Dr. Don.
Okay.
That I know, and Dr. Francois.
And this is in the community.
Within the
here.
yes,
Okay.
here.
Okay.
And I know for sure Hope and Help, you can actually get a free testing sent to you at home.
Okay. We'll
If
list
you don't want
it.
people to know your business,
We'll
can
list it so that way
just
people
reach
will
out to
know.
them.
Okay.
They can send you a free testing. And then now, if you're positive, it's not the end of the world. It's not. It's literally
Because
not.
I know a lot of people are living for
I
long.
have family members that died from HIV. I have family members that I have people close to me currently living with HIV. It's not the end of the world.
No, you just got to get.
You just have
You
to
need
take
to know.
take care of yourself.
That's
Take
with
care of
everything,
yourself.
like you said.
It's just like diabetes, hypertension,
everything.
high cholesterol.
Right.
What do? You take your meds.
Right.
It's the same thing. Just one pill once a day and you're good.
Yeah. Keep educating. I'm so glad that you took this platform to speak on HIV and AIDS so people can be educated.
I love to educate people, and that's why I choose my profession. I love to educate people because I believe if you educate people about certain diseases, honestly, you have a low death rate.
Right. Right. That's
'Cause
right,
people
Miss Nurse Practitioner. Let's talk about that.
People would better take care of themselves.
Yeah, they would. They just need to know.
Yes, ma'am.
So, you're a nurse practitioner. You fought
Yes.
long and hard to get to this position.
Yes, it was a hard journey.
School,
School, work.
family,
Yes.
and you still.
And
you
I'm still
you
at
did
it.
and but you're back at it.
I'm back at it again. Can you believe this?
Yeah, that's good. I mean, you know what? Some people, you have a goal, and you're gonna get to your goal.
That's one thing with me. It's one thing that even my husband would tell you, my mom would tell you. I'm a very determined person. Once I'm determined to do something,
You go for it.
I go for it, and I'm all tunnel vision.
Good.
So
'Cause you see the
even
goal.
you see it. You in life you will have distraction in life, but if you goal oriented, you fix your eyes to what you want to do.
You'll get it.
You're gonna get it.
Yeah.
You have to be disciplined. My number one thing is discipline.
Congratulations.
You have to be disciplined.
But you and your husband, you work together. That's
Yes.
the other thing.
My husband, oh my
need
God.
the support.
God God sent me the perfect person. Because if it wasn't for him, that's what I said, he's my right hand and my mom is my
Your
left,
left
hand.
hand.
Because those two,
Yes, your support.
they're my support.
They're like your canes that keep you up.
That keep me up. He support me in everything that I do. From school to pageantry to back to school to continue pageantry. He always support me.
You know why? Because he loves you and he trusts you, and
Yes.
he's just following the lead. If that's something that you want to do,
Yes.
he's with you.
He gave me his blessing. He gave me his blessing. Thank God. So yes, God couldn't send me the perfect person.
That's awesome.
And I know he's gonna be watching this. Babe, thank you so much for all you do.
That's right. That's right. I know you have overcome some challenges on the way.
Yes.
Going through school. And like I
Yes.
said, you have a family, you have a child. Tell me some of the challenges that you had to overcome or get through.
Well, I can say, thank God, my son is 21. So with that, I know it will be really harder if I had a younger
baby.
Yeah, a younger child. But my son is 21. He's in school, computer engineering. I'm crossing my fingers. He doesn't change his mind. But right now, computer engineering, that's what we're going for. But a lot of challenges, first back to school part, challenges. That's what I said. You have to be self-disciplined and goal-oriented. Because there were so many times I wanted to give up.
But you kept going.
I kept going. I kept going because I keep my eyes on the prize.
What was your why?
My why is for a better life. And my why was I need to be able to support my child, and I have to be able to support my family. That was my why.
Right, and you know the medical field.
In the medical field, I know, and my other why as well, my passion, and it's a beautiful thing when your passion and your profession, your passion, they line up.
Yes.
I love to help people,
Yes.
and I love to educate people. And for me, it's the more you know, the better you can provide to the community.
That's right.
That's one of my why as well.
Keep it up.
Thank
You
you.
need to brag about that.
Thank you.
Because not everybody can do it. Not everybody has done it. And a lot of people have stopped and said, I can't do it. It's too much. But you kept going. And then now you're going back.
Yes, that part.
So tell me, what's the goal? What is the goal?
See, you know, everything always have a why behind it.
Yes.
Again, back in 2020, early 2020, March 2020 to be exact, that's when we were in a quarantine.
Yes.
So I remember sitting at home, I'm like, okay, so I'm done with my nurse practitioner now. What? Because with me, I'm always like, what else I can do? What else I can do to improve? And I remember, still, I'm talking to you like I remember it vividly. I'm sitting down on the couch at home, I'm like, what else I can do to better serve the community?
Oh, wow.
Because right now, with the COVID, everything is shut down. Imagine how many people are going to be depressed.
Right, so many.
Imagine how many people are going to be suicidal.
So many.
Imagine how many people are going to be anxious because now they're at home with somebody they do not want to be at home.
Right.
Especially with kids. School was the comfort zones.
Right. Yes, for
So
a lot of people.
imagine that now they have to be at home.
At home.
7 days a week. Can you imagine what this can do with this to their
course,
brain,
mental.
mentally? So that's why I'm like, okay, I guess mental health is going to be the next thing for me to do.
Good. Good.
So, and that's why, and actually I'm graduating in April with my postmaster's in psychiatric.
Oh my goodness.
Yes.
Congratulations.
Thank
You are so
you.
amazing.
I tried.
You really are, because I've seen
I
you
tried.
work. I've
Yes.
seen you.
That's why I'm always busy. That's why
Yeah,
I'm always
sometimes I
busy,
see you and you're so tired, but you still have a smile. You still have a smile.
I tried. It's God.
Yeah,
I guess
definitely.
God created everybody's their own way. I always want to help people. That's just me.
Yes. Well,
That's
you're
just
doing
me.
it. You're doing it.
Yes.
What's next after Miss Haiti International?
After Mrs. Haiti, well, finish school, of course, because I'm returning the crowd. I can't believe I'm like, wait, I'm returning the crowd already?
Already? It
But the
went
work
quick.
don't stop.
No.
The work don't stop. This gonna be gone, but the work continued.
But you were doing it before this.
I was
And you'll
this
continue
gives me
after.
a bigger platform to educate,
Right.
but the work don't stop.
That's right.
So once this over, the work we're gonna still continue. It's my job is, you know, the good thing I like about my platform.
What's that?
You might think when you on social media, people are not paying attention. People may not liking your posts. People may
They're
like
watching.
posting into any comment, but they're watching.
Yes.
You know, the good rewarding of this for me is having people DM me. Thank you for talking about HIV/AIDS. What you're saying, I didn't know about. If I knew about what you said now,
Right.
maybe my aunt could have saved, my dad could have saved, my uncle could have saved. And that's the most rewarding for me. I don't
It
do
really
this
is.
for money. I don't do this for publicity.
You just want to educate.
I just want to educate
and
because
help people live.
Yes. Let me give you the perfect example. As a healthcare provider, I speak to a lot of healthcare providers like myself. There was like, some of them were like, wait, what? I said, do you know, because I like to do the slow, do you know things with a lot of my provider. I'm like, do you know you can literally, somebody can be HIV positive and the partner is HIV negative, and they can have a baby that is HIV negative. They're looking at me like what? Again,
Because they didn't know.
there's a
It's
lack of
education.
education. And those, I'm talking about healthcare providers. That's why I always said education is key.
But
you
you know
have
what?
to educate.
And some of them probably don't even really, because see, that's
Stigma.
your, right.
A stigma.
Right.
A lot of providers, they're like, okay, you want to know about HIV, you want to do HIV, just go,
to the health
healthcare.
department.
Again, the stigma.
Why? Just help somebody live.
That's all it is.
Yeah.
That's all. Just that one education. It's literally one pill once a day. That's it. HIV back in the day, I've been a nurse, bedside nurse for 11 years. When I used to have those HIV patients, they used to take like 3 or 4 pills, and those pills just literally like, you know, those big multivitamin pills.
Yes.
Now
They're tiny.
with the advance of the pharmaceutical, it's literally, they combine them together, one pill, once a day. I have patients all the time that give me excuses. Well, I'm not going to remember. I'm not a good with pill taker. I said, okay, there's something called a pill bottle. You can give me an excuse you don't have water. That's literally something called a pill bottle. It's literally a bottle with 7 days worth of pills to the side. If you're a morning person, leave it by your bedstand.
Take it in the morning.
As soon as you get up, take one. If you're a night person, you go to the gym, whatever you do, that's your water. You need water for the gym. Just take it with you. People don't know
No
what it is.
excuses. Come on.
Yep.
No
No excuses.
excuses.
One pill once a day.
Yeah, I'm trying to keep you healthy, trying to keep you alive. Take this pill.
That's it.
Take this pill.
And keep the virus down. Keep the viral load down and your CD4 count up.
Oh my gosh. That's
Yep.
I'm glad. I'm so happy that you chose that. I really am, because you don't really hear about it. You know, a lot of times
I
it
get
seems like
backlash.
HIV is in the
It is on the back burner.
It's in the back.
Yeah.
But you boldly speak
I speak. I get
Yes.
backlash sometime on social media. I just put, I don't care. I say,
regarding HIV.
yes. I got the people like, why you always talk about HIV? Do you have HIV? I know my I know my
I'm
status.
trying to educate people.
I know my status. Would you like me to guide you to know your status?
There you go. Shut them down. Keep talking about it. Keep it up.
I won't stop.
Oh, keep it up. People are loving it.
Because I'm telling you, by doing this, it's like you give people hope.
Right.
Because of the stigma, people are so scared to talk about it. But by you talking, that's literally give them hope.
Right. Yeah. It's gonna. I can still be here.
Yes.
It's not a. It's not such a bad thing. I'm
Then
not gonna
we
die today.
No.
I'm
Yep.
not gonna die today.
Yes, indeed.
Yeah. Keep talking about it. Keep sharing that information for people.
Yes,
We need to
ma'am.
hear it. I love that. Anytime
Thank
I
you.
see you speaking or just doing a post, whatever, I'm like, yes.
I
Keep it up,
tried.
keep it up. Keep it
I
up.
try. When I do those interviews, of course, I'm from Haiti. I was not born here, so I still have an accent. But
It's okay.
I always tell people, don't pay attention to the accent. Pay
Just
attention
listen to the message.
to the message, because there's something in there for everybody.
That's right. That's right. And you're getting it. You're getting out. You're getting the message out.
Yes,
That's the most
by all
important
means
thing.
necessary.
Yes. yes.
Yes.
On this journey, we're going to go back to your nurse practitioner and with your school and education.
Yes.
I know there has to have been a time, even though you see the big picture, it's right there, you're looking at it. There has to be some times that you just said, I can't do this anymore. I've
Oh,
gotta
there's
stop.
many times.
I can't do this. I got this test to take.
There was
I
many
haven't studied
times.
for it. I don't think I can do this anymore. What kept you going?
A lot of prayers. My mom always prayed, and my husband, that's one thing he always does, prayed. He prayed. My husband prayed more for me than I prayed for myself. I can tell you that much.
Wow.
This man prayed more
He's a
for me than
praying
I
man.
prayed for myself.
What a beautiful couple you are.
God, I can tell you what kept me going is God, because there's many times that I'm like, sometimes I say to myself, I'm always, and I can say it openly, I'm always a struggling student. I always struggle in school, but that don't stop me.
No, you keep going.
I keep going. That's one thing with me. I like to challenge myself. That's one of the things that keep me going. Is prayers. Is the number one.
Prayer is number one.
Prayer is number
Right.
one.
Yeah, that's for all of us.
Because there's many times, there's many sleepless night, there's many cry, there's many disappointment. Yes,
Yeah, but here you are.
but God.
Yes, but God. Exactly.
Yes, but God.
Yes.
Yes.
You look good. you look, all this glitz. I love looking at this crown. I love it. And then you've got your sash has the stones on it as well.
Yes.
What would you say to someone that says that she looks so pretty? I would love to wear that crown. I would love to look as beautiful as her. What would you say to someone that wants to enter a pageant?
I'm going to answer that question in two ways. Way number one. I know a lot of people be like, I'm not pretty enough. I can do pageant because there's a lot of myth going around with pageant.
I believe it.
Number one thing with pageant, those girls, they all prissy with heels and sash and crowd. They're working around certain ways. I'm letting you know now, right now, this is not what it is. After I won Mrs. Haiti in April last year, I went in July in Tennessee competed. I went to compete with 50 other women, 55 other women from various states and international. When I tell you, those women have some amazing story behind that crown and sash.
Right, you don't
they
know.
have some amazing story. You have people that went over depression. You have people that went over postpartum depression.
Really?
You have my sister Queen. Her son had leukemia.
Okay.
So she was there with them for the whole everything, the treatment and everything. So now her platform is to help other mothers
that are going through
the same thing.
Right.
Pageantry is not always crown and sash.
Right. It looks pretty.
It looks pretty.
Yeah.
But there's always something behind it.
Right.
It's not always like prissy. There's always a message behind it.
Right.
And I do believe I'm going to speak on behalf of a lot of other queens. Like me, we use pageantry as a bigger platform.
Correct. Like
for
you
us to educate others.
To educate on your different, whatever it is that you want to speak about.
Yes, ma'am.
With your HIV.
Yes.
Yeah. So I like that. That was very well said. It's true because it looks beautiful.
There's a message behind it.
There's something behind it.
Every single one of those queens went through something, or they have somebody that went through something.
Something as well.
Yes.
Yeah. Thank you.
You're welcome.
Thank you. I know you said you're gonna wait. You're gonna rest this year. No more pageants.
Yes, for the rest of the year because, of course, I have to wrap up with school and everything. And like you said, like sometime you have to debrief.
You have to.
Yes.
You have
mentally, especially with everything's going on right now.
Right.
With everything going on in the world, worldwide.
You have to.
So you have to have a mental break. So, yes.
Good. Take a moment.
But the work doesn't stop. I'm still going to educate. But it's just like with the travel and everything, yes.
Yeah, you're still going to speak about it because you were doing it before.
I was doing it before.
You're not going to have the crown or the sash.
But the work continued. Anytime anybody that's want to have a education session about HIV AIDS, I'm welcome.
You're for it, yeah. Good. So what other things you have going on or that you'd like to do?
A lot. A lot, actually. When I'm done with this, and I'm on my last semester of my postmaster's for psychiatric, so I'm going to go in and take my test.
Okay.
And hopefully work, because that was the goal, work with patients, mental patients, because they need it. A lot of time, all they need is this one person, just for 5 minutes, sit down and talk to them.
Talk to them.
That's all they need.
Yeah.
And that's one of my plans, finish with school and take my board and enjoy the rest of the year and work on some personal things that me and my husband, we plan on doing.
Right. It's your time.
Yes.
It's your time.
Thank
How can the
you.
viewers contact you?
Well, you can contact me for now through Instagram. It's just one word, Mrs. Haiti International 2021. And through Facebook, it's Marteng Louis Charles Adolphe.
I love the way you say it.
And through email, which is my first name, marteng.adolphe@yahoo.com. I'm always open to help the community with anything.
Thank you.
You're welcome.
We're going to take a candid minute.
Yes, ma'am. Thank you for having me.
Of course. You always walk with your head up high.
Yes, ma'am.
With
Thank
or
you.
without the crown.
Yes, ma'am.
What keeps you and makes you so confident?
I believe in myself. God first, and I believe in myself. Everything that I do, I know with God have my back, I can be and do anything through God who strengthened me.
That's right.
Yes, ma'am.
Oh, that's beautiful. I love that. Thank you so much.
Thank you for having me. Thank
so
you.
nice seeing you.
I know. Thank you. I know with COVID, it's like we talk on social media, but it's like it's a whole different vibe.
Different. We want to see each
yes,
other.
we want to hug each
That's
other.
right. It's coming back.
It's gonna come back.
It's coming
No.
back. Keep protecting yourself. Keep spreading the word on
Yes.
HIV.
Yes,
Keep being
ma'am.
beautiful, with or without the crown.
Yes, ma'am. Thank you. Thank you.
right.
Thank you. Thank you.
You're welcome. We thank you for joining us this evening. Please join us next Tuesday at 6 p.m. for another guest right here from our community. Marteng shared with us her reign as Miss Haiti International 2021 and the importance of her platform of HIV, raising awareness and reducing the stigma. The CDC states there are 1.2 million living with HIV in the USA. There is a huge stigma surrounding HIV. We can stop this by having one conversation at a time. Awareness is everything. We are real sisters sharing real stories within our community. We thank you for tuning in to Let's Talk About It, the Candid Conversation Show.
Go, go.
Come on, let's have a candid conversation. Let's talk about it. Just bring it up, we got hope and love.
Yeah.
It's all about you and your well-being. The Candid Conversation Show. Let's go.